Well, hello there, everybody. What a awesome way to come out of the holiday and doing live video across multiple platforms and everything goes completely haywire. Well, that's about par for the course, right? It's always a challenge to get all these things to work properly at the time you want them to work. Uh, First of all, the event itself was put at the wrong time by the crazy platform because I guess it when the event was set, we were in a different time zone, so it grabbed the time zone we were in and adjusted it as it wanted to. So appreciate everyone being here because it's been obviously quite the morning of change. Those of you that were expecting it to start 30 minutes ago, I appreciate y'all being patient. The platform, we could not get it to work properly at that point in time, and it just became quite the ordeal. But we appreciate you being here now. Glad that you could spend some time with us. We're going to talk about some interesting things today. Interesting to me. Hopefully, it'll be interesting to you as well. You know, the question has always just kind of bothered me. It really made me start taking the pathway that I did, looking for alternative answers to access to healthcare. And that question is simply the same name as this program: is why does healthcare suck? And it's an interesting question because it offends some people. It certainly offended Dr. Roger Mochigumbo, who is a DPC doctor here in San Antonio. The very first time I was talking about the name of this particular thing when I started it last year. And there's a good reason why it should offend him, right? Because his thought is, what are you talking about? My healthcare doesn't suck. My patients love me. And he cares a lot and loves them. He takes great care of them. So the blanket statement of why does healthcare suck is certainly doesn't apply to every single bit of our healthcare system, but it does apply to it overall. And it's really hard to argue that point whenever you look at the cost of medications, when you look at the cost of hospital stays, when you think of, our healthcare spend is about 20% of our gross national product. I mean, that's about 20% of our economy is on healthcare. But if you really dissect that, you find out real quick that it's really not actually spending money on healthcare that is 20% of our economy. What you're really seeing there is that there's a lot of waste and there's a lot of administration. So we're going to talk about some of that. We're going to talk about kind of how we got here today. As people have filtered in, we want to make sure that you understand that you can comment regardless of what platform you're on, whether you're watching us on YouTube, you're watching us on LinkedIn, Instagram, Facebook. We are across multiple platforms. I believe that we're on Twitter this time as well. So if you have a comment, or later on, there's going to be even an opportunity if you want to share your comments, then we will have a way for you to do that as well. Even come up on stage if you want to. Those of you who have been following the Why Does Healthcare Suck series over the last several months as we've done this, realize that we have made a transition away from a full audio broadcast to a video broadcast. Part of that is so that we could be across multiple platforms simultaneously. But there's always, as we saw today, there's always some technological things that can happen. And as Murphy's Law says, if it can go wrong, it'll go wrong. All right, so let's kind of jump into this thing. And don't forget, you can make comments. I do have my lovely wife, Kelly, who is standing by to help me address those comments as well and make sure that they're brought to my attention as we move forward. All right. Excuse me. So this really, the whole thought of why does healthcare suck really came to me last year when I realized that I wasn't the only one who kind of thought this way. A Harris poll showed that 70% of Americans feel the U.S. healthcare system has failed them. So if 70% of Americans feel that the healthcare system has failed them in some way, then how else can you say it other than, wow, our healthcare sucks. How can we have this poor a healthcare as, one, if not the wealthiest nation in the country, in the world, one of the wealthiest? But then you turn around and you look at other numbers that show that we also, with those wealthy countries, we don't have the longevity that they do. Our life expectancy is not as high. And we've seen this decrease over the last several years, as in concert with that, as our life expectancy has decreased, the cost of healthcare has continued to increase, far outpacing inflation. Well, what's going on? What has happened that has put us in this quandary? Because it's really untenable. Let's be honest, it's untenable. And it's brought to attention a lot of crazy ideas that some people have. There's no doubt about it. Maybe I'm one of those, and that's okay. I'll stand up and say that I have some crazy ideas. But there's been a lot of crazy ideas out there over history. A lot of them weren't near as crazy after they started working and made dramatic changes. Imagine your mom always told you never get in the car with strangers. Everyone does it every day now. You're paying some person to pick you up and take you somewhere in their personal car. You get in car with strangers all day long. Kind of a crazy deal, right? It flipped it on its head. But there's a lot of things that I believe will happen, or are happening now and will happen in the future of healthcare, that will have a dramatic change, just like we've seen some other models do to other parts of our day-to-day life. But let's talk a little bit, first of all, how we got here, because I think it's important to understand the history of healthcare in the United States before you can understand what's going on right now. Most of us can remember, those of us at certain ages anyway, how different healthcare used to be. But for many people, it really wasn't. Health insurance has been around longer than most of us realize. And a lot of folks look to the Blue Cross Blue Shield Association as the first time that was ever put in place. But actually, it dates back, the real actual prepaid, what they call health insurance type model, dates back to 1929. Who would have thunk it, huh? And I am doing this broadcast from San Antonio, Texas. That's where we are based out of. But right here in Texas is where that first model was introduced. And it was by Baylor University Hospital. So Baylor University Hospital introduced a prepaid plan in 1929. And that actually became the blueprint for what Blue Cross insurance plans became down the road. So, yeah, I guess it's our fault. If you want to blame someone, I guess we can blame Baylor, right? But it's interesting because I really didn't realize that it went back quite that far and that model was there. Most of you probably know that the first true, what we call employee-sponsored insurance plans actually occurred during World War II. Not after, but during World War II. And the reason for that is because there were freezes on wages or controls on wages. And so to be competitive, and of course, there was obviously a much dwindled workforce at that time for companies competing for folks, then health insurance became a benefit. Employers started offering that because they could not increase wages. So it gave them a leg up. Interesting, right? Because think about what today looks like, how important benefits are to employers in attracting and retaining personnel. Hasn't changed since World War II. Think about that. That is kind of crazy, right? This is what it was brought in to begin with, and it's still vastly important today. Companies that are smaller and don't have to offer health plans or benefits obviously gain a leg up on competition when they do something, even if it's voluntary benefits, even if it's offering something like an HRA that gives a little bit of cash towards or gives money towards any kind of health needs that an employee may need. Interesting concept that it really came out during that time. Of course, where the big changes started happening is when Medicare came into play in 1965, and even more so on the commercial side in the 70s, late 70s and early 80s, when HMOs became a thing. Those of you that remember that, and I do remember that, it was a game changer. It was a game changer for the insurance companies, but more than anything, it really brought in a whole different idea of what health insurance could look like. And of course, the terrible, frightening term managed care, because that's truly what it was. It was a health maintenance organization. Now, the interesting part of this to me is through all of that turmoil, through all of those changes, because nothing truly, truly dramatic other than some technological advances and things that happened in there, nothing really big happened. Of course, we had PPO networks come in to be the antithesis of what the HMOs were, but nothing truly, truly big happened, of course, until the Affordable Care Act was signed in 2010 and really kicked off a few years later, because then we saw the dramatic effects of that, right? But the interesting thing to me about all of this, especially the HMOs, is their real goal was to get people to have to go through the gatekeeper, that primary care doctor, so that they would have a healthier life, right? Because I've got this primary care doctor that's making sure I'm staying healthy. Well, where did it go off the rails? Because it never happened. If you look at the health of Americans now, it's really never been worse. Chronic diseases are rampant. Diabetes is almost an epidemic. Obviously, obesity is a huge issue. But you look down the line of all of the different chronic ailments out there, autoimmune issues are at an all-time high. All of these different things that are going on could have been dramatically affected in a positive way with proper primary care. It's exactly why the cost of our healthcare is so much more expensive than other countries, is because most other countries focus on primary care, and that helps you avoid the high cost of specialty care, obviously the high cost of hospitalizations, high cost of medications, if primary care is being done properly, which is why Dr. Muchagumbo got upset with me, is because he's taking care of his folks so that they don't have these high out-of-pockets. And I can also understand why other direct primary care doctors feel that way, because their health care doesn't suck. But the numbers say otherwise overall, right? It's a wonderful thing for his patients. It's a wonderful thing for the patients of doctors, not just in direct primary care, but other in primary care practices that care enough about their people to give them the time to listen to them, to give them the time to help them avoid chronic illness or to actually be cured from chronic illness, that don't just throw medications or give them referrals to specialists, but instead actually focus on what the root cause of chronic illness or whatever is going on with you. When they do that, it changes the outcome for everybody. And I do mean everybody. Because if you're on an employer health plan and all of a sudden you're not a high spending employee on that health plan's dollar, it just changed the benefits for everyone. Now you don't have these claims that cause that to go up. One of the things a lot of folks don't understand is that insurance card that you have, most folks treat that as an unlimited credit card. They treat that as, I can just go and whatever my copay is, and then everything else, or whatever my deductible, everything else is taken care of by the insurance carrier. It's not my money. Brother, it's your money. If you're part of whether it's a co-op or you're part of an employer plan or you're part of an association plan, it doesn't really make any difference. It's your money. You're putting money into that plan. When's the last time you got a raise? Well, guess what? Every year when your plan goes up, the cost of that goes up, the premiums go up, your insurance company's getting a raise. It's your money. Because you are not treating it that way, because you don't care enough to shop properly and just give that card that gives you unlimited access at a set rate, you don't understand the ramifications of that. And that is very, very true, especially for large employers that have very rich plans with low deductibles, and people just take advantage of it without realizing what the end result is going to be on both themselves and the plan itself, which in turn then comes back to them. even when they don't understand what's happening. If you're curious about why every 2 or 3 years your plan changes from one insurance company to another, if you're curious about why the rates keep going up all the time, it's because people are not being fiduciary of their own self. They're not advocating for their own self. They're not shopping. Consumerism has truly been taken out of health plans because there's no place for it. It doesn't matter to me. I have this set amount that I pay. The insurance company pays everything after that. This is even, it's very interesting because part of what they did with the surprise billing plan is a lot of folks were getting, or there no surprise billing plan act, is you're hoping, okay, great, this is going to be even better. I'm not getting any bills on the backside now. But people that had kind of reeled in how much that they used their plan, that then gave them free rein to go ahead and do it again. So kind of it had really the opposite effect on what we would hope would happen in that case. There's so much to dig into, but that is a little bit of the history here. We know kind of what ACA has done. We know that in states like Texas now, if you have a marketplace plan, the only thing available here is HMOs now. We don't even have PPO options. So you're kind of in an interesting situation whenever that's what you're looking for is a PPO. You can't have a marketplace plan then if that is a concern of yours. We also see less and less plans covering in other areas. So imagine that you work for a company out of California, but you reside in Texas, or you reside in North Carolina, or you reside in Pennsylvania, and your company plan is based in California. There is a good chance that, depending on the plan that you've chosen, that you're not going to find anyone to cover you except for emergencies where you're at. The way that these plans are now controlled as far as meeting certain guidelines through the ACA, through ERISA, through all the other things that they have to comply with, it's very interesting what the end result has been to many users. Unintentional, I believe, in a lot of cases, but it is certainly where we have seen some of the gaps fall from many of these plans. You also have to watch out whenever you are looking for plans outside of that, right? So we know that there are ACA plans, and those are going to cover certain things. People have turned to other options, such as short-term plans. I actually love short-term plans. I think they are a great fit for many, many people. But if they're not sold properly and people don't understand what the limitations of those plans are, including, in most cases, an upper limit on how much the plan will pay for your lifetime, or sometimes annually and for your lifetime, they can have devastating results on someone financially. But the problem with all of these issues is that they can also happen even on a traditional plan. I mean, that's still why the number one reason for bankruptcy in this country is medical bills. That hasn't changed in a long time. And of course, a lot of that is because 33% of our healthcare spend is hospitalization. It is by far the highest spend of everything, of all the different spends combined. It is by far the highest of anything else. Medications aren't terribly far behind there, but it is definitely by far the biggest spend that we have these days. So when you look at all of these issues that we have, there's got to be an answer, right? There's got to be an answer to how do you address these issues. Well, I've talked about a little bit of that, and that is DPC. But overall, this is going to be a little bit controversial. That's okay. I'm kind of a controversial type guy. Overall, for most people, especially if under Medicare age, when you're Medicare age and over, and you've got a whole other list of things that you have to deal with at that point in time, and there's really not a lot of great options for you other than Medicare and whatever you can get on to go with that. I prefer a supplement. If you want to know my preference on that, I think a Medicare supplement and prescription drug plan, if it works out for you, is the best way to go, simply based on the fact that you have less limitations there. Obviously, Medicare Advantage is gaining a lot of traction, but that's a separate conversation for another day. But when you're in the under 65, especially in the employer world, and if you're in that under 50, where you do not have to provide health insurance, but remember, we're talking about 90% of companies in this country are under that 50 employee, then there are ways to provide excellent benefits to your employees without insurance. That's right, without insurance. Because if you actually let someone who knows what they're doing, a healthcare supply chain specialist, build you a custom plan based on what your needs and your employees' needs are, cut out that middleman, get rid of that big insurance company, and build a plan for you, then all of a sudden you've got the benefits you want. You can control your healthcare costs better. And your plan is long-term, more fiduciarily in line with what your company is all about. You have made decisions now based on your company and your employees' needs and have a plan that's in place that really, and once again, you're putting parts together that can make what you have put in place work very similar to a traditional health insurance plan, but it's not health insurance. It really is a custom made plan. We'll call it a plan because it still is going to meet all the legal requirements of being a plan, even though it's not technically insurance. I know that's kind of a crazy thing to say, but there are ways to build it so that it meets all of the fiduciaries of ERISA and it meets all of the essentials of ACA and still isn't technically an insurance plan. And there are other ways to do this as well. Once again, there are ways to join consortiums. There are ways to do association plans. Even though that has kind of been pulled away some, there are still some bona fide association plans out there that are actively bringing people in. So those are solutions that are really available for folks that are looking for better ways to do this. It's very interesting to me that we have got to this place in our spending, once again, 20% of our economy, that we've got to this place in our spending that it's on everyone's tongue, right? It's in everyone's mind. It's certainly out there with a lot of the Senate, the House. It's been talked about, of course, by President Biden a lot. They've talked a lot about how to reduce the cost of healthcare. The problem with everything that they throw at it is they don't really understand why the cost is high to begin with. They want to try to blame it on one thing or another and not looking at the overall holistic reason why the cost of healthcare is so much and what the underlying issues are. Once again, we talked about, it's about $4.5 trillion is what we're spending on healthcare. That's what that was the 2023 numbers, about $4.5 trillion. But when you start thinking about it in a different way about what we're spending, 25% of that, right at 25% of that is just administration. Just administration. What? So no one's receiving any health care. It's just the administration of that. Another 25% of that is waste and fraud. So once again, no one's receiving a benefit. And in many cases, the opposite. Imagine that we could take out just those two pieces. We've actually cut the cost of healthcare in half. Now, I'm not saying that that's even possible, but we certainly could put in a number of different policies that could change that dynamic. Now, here is the key to this. We don't have to wait for the government to do anything. Every single time that we wait on the government to do something about any of the issues in healthcare, we're just waiting to be disappointed. Because rarely, if ever, do they put a policy in place that actually helps us truly address the bigger issues at play. But there are actual solutions in place already. That's what's cool about this. is we're working on a problem that the solutions are already there, but in many cases, we're waiting for the government to fix something that doesn't actually need to be fixed or changed because solutions are already out there. PBMs are one of the biggest issues that people talk about all the time is the high cost of medications and how PBMs are part of that. Without a doubt, there's some issues with manufacturers too. But when you really look and see, we'll use Ozempic as an example. Ozempic costs $800 to $1,000 a month, but the actual amount that the PBM is getting, if you're talking about one of the big three anyway, is 75% of that. So if the PBM is getting 75% of that, what could the cost really be? The cost is not that high. The cost is artificially inflated to be that high. We can do something about that, but most times you fail to do it because so many companies still go with the big three PBMs that they're still seeing those higher prices. 80% of companies, 80% of plans use the big three PBMs: Optum, Express Scripts, CVS Caremark. When they're using those, they're not changing the game. They're not affecting real change. But there's tons and tons of PBMs out there that are fiduciary, that are transparent, which that's a whole nother word that we can use right now and decide what that really means, right? But if it's a fiduciary transparent PBM, fiduciary being the key word there, they also use words like pass through and they don't take rebates. You got to watch the language of them. But even one of the ones that is not really 100% on the up and up and not truly doing the complete best, not a full fiduciary, even those are better than the big ones that are taking advantage of everybody. Do a better job shopping. Look for some of the real solutions that are out there. You know, I'm not going to get too deep in AI, but it's there and it's going to make a big difference. It's going to make a big difference in the administration side as well because of how many functions it can do. Now, all we're hearing about primarily right now is the bad things it's doing, right? We're hearing all the auto adjudication and how insurance companies are using it to deny more claims than ever before. But AI only does what it's been taught to do. I'm going to say that once again, a little bit louder for the people in back. AI only does what it's been taught to do. It's certainly going to learn. That's what it's about. But once again, it can only learn from its experiences. And so if it's taught to do things the proper way, if it's taught to adjudicate claims the proper way with the proper information, you'll get the proper results. So every time we hear one of the big insurance companies say, oh, no, that's not what happens. Come on. Just admit that that's what happened and do better. Just do better. That's all really any of us can do, right? We can just do better. Those of us who are insurance advisors, you can call yourself a broker, you can call yourself an agent, call yourself a consultant if you like to, which is what we are. If you're out there still promoting the status quo, you're part of the problem. It's not going to get any better as long as we keep this information, keep the fact that there are solutions to help lower the cost of healthcare away from our clients. We've got to be fiduciary ourselves. We've got to make sure that we're providing the information to our clients that helps them make a great decision, helps them to be fiduciary of their plan, which legally they are. If you're an employer out there and you didn't know this, you are responsible for your plan. You're the fiduciary, not just of your 401k, but of your health plan. If you've never heard that before, surprise. This is not anything new, but the light has been shined on it a little bit brighter. And there will come a time when the reckoning it's going to come about. The reckoning is going to happen. More and more is being looked at on this. It's not a surprise that people are using this as potential to get into your door and tell you more about it. I think if someone is coming and knocking on your door or sending you emails or calling you about the fact that, hey, did you know you're fiduciary of your plan and you better take this seriously? You better answer that email. You better reply to that text. Maybe you want to check the person out a little bit more. I don't doubt that whatsoever. But if someone is really looking out towards you and saying, hey, I'm here to help you because you legally are responsible for your health plan and making sure that your employees are getting the best care, quality care, because that's part of it, and that you're being fiduciary of your entire plan, including how much people are paying for their medications. Look no further than the Johnson & Johnson lawsuit. If you aren't familiar with that, go out and search for it. It won't take you long at all to find out what's going on. Johnson & Johnson is a huge, huge company. Employee has sued them for being non-fiduciary of their health plan because they're paying thousands of more dollars for medications than what they could pay for them because of the contract that they have with their PBM. Why does healthcare suck? Things like this. Things like plan sponsors not being fiduciary of their plans when options are there. Once again, we don't have to wait on the government. There are real options out there. Tiered plans. Raise your hand if you know what a tiered plan is. I'll raise my hand. Tiered plans allow employees in a plan like these we're talking about building. If you have a plan that's built, you can build tiers into it where your employee has the same opportunity to go through a network. They can go through that PPO network if they want to, meet their copays, meet their deductibles, go right on down that pathway, just like they always have, or they can go on another tier, down another direction, through direct primary care, through medical utilization management, going to high quality, great outcome centers of excellence, making sure that their health is paramount on that pathway. And everything down that path is zero cost to the employee. So you have your traditional pathway where they can go to any doctor or facility they want to in a PPO network, or they can get true guidance that is in their best interest to make sure that they get the proper outcomes, better outcomes, higher quality, going to the proper physician, making sure that they get the right care at the right time at the right place. What's wrong with that? Why wouldn't someone want that? Because we have trained people to think that health insurance and health care are the same thing when they're totally different. The person going up that PPO network believes that that's the only way to go to get quality health care. But the numbers prove time and time again that that is more costly, and the outcomes are not as good as when you go the other route. Better overall care is really a part of not making healthcare suck, making it a better experience overall for that patient. 61% of Americans don't go to the doctor unless they're sick. That puts us right back at the place where we were, where we talk about primary care and the importance of primary care and folks not getting the care that they should get. Because if you're afraid to go to the doctor because you don't have any idea what the cost is going to be, let's say that that, I'm going to use an HSA, and I like to beat up HSAs in many cases because they're not properly explained to people. If they were used the way that they were designed to use, they're a wonderful, wonderful plan for folks. They've got that tax-free care that they can get. Wonderful. The problem is people don't understand them. People typically don't have that account opened up. If they do, they don't fund it enough to actually do anything with it. So it becomes another barrier to care, which most health plans do these days because of high deductibles. But in an HSA, you still get that HSA is going to be an ACA qualified plan. So you still get all of your preventative care for zero cost. Well, why don't people go? Because they're afraid they'll find something. Is that plan really the best option for them then? If they're so concerned about going for their regular preventative care visits that they will not go because they're afraid someone's going to find something, then what am I going to do because I don't have any money? That's not access to healthcare. That's a barrier to healthcare. That's putting us right back in the situation that we've been talking about, where primary care is not being provided to the individual, and therefore they're lost in the system, waiting for something to happen that all of a sudden puts them into the bracket of higher out-of-pocket cost. Once they cannot afford to not go anymore, once again, 61% don't go unless they're sick. Once they're in that sick category, then where are they going to go from there? It's just going to be higher out-of-pocket cost. We, in the last few months at Eagle Care, we have been very blessed to have a partnership with an outstanding partner in Houston, San Antonio, and Austin called Next Level Urgent Care. With Next Level, we're able to provide memberships to many of our members so that they can go and have primary care and urgent care at zero cost. It's a beautiful thing. The biggest number that I have seen, that is personally to me, I think is the most important number, whenever they've provided the data for the folks that are enrolled in this program through us, is that 29%, they have a survey that they do saying, hey, if you wouldn't have come here today, what would you have done? Yeah, I would have went to an ER, I'd have went to another urgent care, I'd have went to a primary care doctor, or the last one, which I believe is the biggest, 29% said they would have done nothing. 29% would have done, as we call back in my day, just rub some dirt on it, or just let me go over to the pharmacy and try to find something to take care of myself, or let's just wait a few more days and see how things work out. Well, we know a percentage of those, because they didn't do anything, would have ended up in the ER, might have even ended up hospitalized, or had a much greater out-of-pocket cost. Now, there's no doubt that the 13% that have also put on there that they would have went to the ER instead, that would have certainly been a higher cost. But to me, the 29% that said they would have done nothing, we have actually completed our true mission at that point and provided them access to health care. That's what this should all be about. Everyone talks about that it should be a right. It should be a right to have access to health care. In fact, that's what they lauded that the Obamacare, the Affordable Care Act, was all about, is provide people access to health care. However, in many, many, many instances, it has done just the opposite. You'll never convince me that providing someone a health care plan with zero premium, right? Woo, I got a free health plan with a $9,150 deductible is giving them access to health care. You'll never convince me of that. And as these deductibles and these out-of-pockets continue to skyrocket, all that's going to happen is that we're going to stay in this same exact hamster wheel of continuing rising cost, continuing lack of access to healthcare, continuing to have people say, why does healthcare suck? What can I do about this? Well, there are solutions out there. Many of the folks that come on and watch this episode, many of the folks that have been on the show in the past, many of the folks that we talk about daily that have been either on my Health and Well Power Hour podcast, many of the folks that I'm connected with on LinkedIn, there are solutions out there. Stop waiting for the government to fix something that they will never fix, because they will never fix it. In fact, most people will say in the government, at the insurance companies, in the hospitals, that the healthcare system isn't broken, because it is actually functioning exactly the way it was designed to work, to enrich those it was designed to enrich, and to bankrupt those it was designed to bankrupt. I'm going to kind of leave this right here right now. I would love to hear any comments or any questions anyone has to cover any of the rest of it. You may have noticed that whenever I start these things, a lot of times I may have a slight idea of where I want to go, but I kind of go wherever I want to. Hey, it's my show. I can do that, right? But I sure hope that you guys have enjoyed some of the insights that I provide, some of the thoughts that I have. You may have different thoughts completely. I'd love to hear those. So I'm going to give you just a few minutes to put any comments that you might have in, any questions you might have in. If you want to come up on stage and provide your insights, I would love for you to do that. If you want to send us a message, you can go to the Eagle Care through where all these are at. You can go to the Eagle Care and send a DM, and then if you include your email address, or if you just send the DM, then Kelly can send you over a link to get up on stage. We're just going to give a couple more minutes for that. I know that this platform and this way that we're doing this is a little bit different than how we did before. And it used to be much easier to get up on stage. We're still working through all the nuances of that. And I want you guys to know that we also welcome any input on this particular platform and the way that we're doing this as well. I will tell you that LinkedIn, and most of the other platforms as well, you'll understand this, they really like the video much better. Today's technical glitches notwithstanding, they certainly like that much better. I can tell you that different platforms, the way that we use it, it actually certainly we're able to reach more people by using this type instead of just sticking with LinkedIn audio. And that is really the goal. The goal of what we're doing is to reach as many people as we possibly can with our message. Also, because of the crazy technical things, we know that we started at a weird time. Many people thought it was going to be at 10 a.m. Central. Other people thought it was going to be at 11 a.m. Central. And so we split the difference, and it was at 10:30 a.m. One of the other great things about having it on these platforms is that it will replay. So as soon as the event is over, it will be right there for you to watch in its entirety. And then, of course, you can always make comments or have questions after the fact as well. Love to respond to those down the road too. So if you make a comment after the fact, we'll certainly be coming in and checking all of those and responding to whatever you have to say as well. So I'm going to take a couple of drinks of coffee and give you guys a chance that may be sending any comments in. And then if we don't have any, we'll close her up. All right. I am not seeing any comments, but I certainly do appreciate everyone being here today. All right. Just to give you a couple of things that we got going on. Don't forget, if you want to listen to the Health and Wealth Power Hour, my podcast, that is released weekly, then you can go out to hwpowerhour.com. Also, reach out to me on LinkedIn. If you think you would be an outstanding guest for the Health and Wealth Power Hour, if you've ever listened to it, you know that we talk about all kinds of stuff. So love to have a variety of guests on there. Please reach out to me. You can message me directly on LinkedIn, and I would love to talk to you about that. Our next event is actually in just a couple of days. So on Thursday, I am doing a joint show with Mr. Tim Urich, and our show is 10 a.m. Central Time. I promise it's 10 a.m. Central Time on Thursday, and it's called Dollars and Cents: Creative Spending Strategies for Small Businesses. So we are going to really be talking about some of the cool things that small businesses can do that are very kind of out of the box, okay? Very out of the box strategies small business can do to really get control of their cost. Tim is on the financial side of the world, not the insurance side, not the benefit side. He has definitely got some unique ideas on how small businesses can really regain control of their cost and not let not let the market and other things be in control of that. So really appreciate everyone doing this. Hold on. Let me see here. We did have a question come in. For an employer, what is the best way to start the process of looking at other options for healthcare? That's a great question, and it is one, of course, that we get asked all the time. If you're looking for other ways of getting options for healthcare, you reach out to someone such as myself, a healthcare consultant. That we're actually business consultants, but we focus on that healthcare supply chain and we focus on that healthcare side, and we help you understand what the difference is between health insurance and health care, and how you can build a plan or processes or just different solutions to get health care access to your employees. It's a totally different way of looking at it. What most folks are concerned about with any size business, but small business in particular, and once again, I'm going to talk about this with Tim as well, is how do I control these costs? Why do they keep going up every year? We helped a company out of Illinois not too long ago, at the first of this year, that ACA plans had literally priced them out of providing benefits to their company. They just couldn't do it anymore. They were just done. He just threw up his hands and said, I just can't help it. I can't do it anymore. I want to provide benefits, but there's nothing I can do. Nothing is affordable. Well, he had what you would expect to be a problem. What they do was they had craftsmen that worked for them, people that were pretty well trained and did craftsman-like work. He had a hard time attracting them. I don't have any benefits. He didn't realize that you could do something very different, provide even better benefits than he had before. And that's what he was shocked at. And we were able to do that. We worked with our good friend Terry Shook to make that happen for this company. I'm not saying that what we did with Terry's group is an answer for every single group, but it's an innovative, different way to look at it. And all of a sudden, it's changed the dynamic of his company because now he has benefits again. And his potential employees and current employees look at it differently. There are very innovative strategies that can be had, but you've got to talk to folks like Terry Shook, talk to folks like myself, talk to folks like David Cotorno. If you're a larger group in particular, David's got some great answers for you. If you want to talk to the whole network of people, go out and check out Next Gen Benefits. NextGenBenefits.network is a great place to go and find some answers to what the problems are today. And if you're an employer, hook into a network of people, network of advisors and consultants that have these answers, that know we're not going to fix the problem. We're going to build a parallel system that works the way it's supposed to, that is truly patient-centric, based on patient care, not based on profits. That's one of the biggest issues of our entire healthcare system, is everything is based on profits. We look at it in a very different way. That's how we help you control your healthcare cost. All right. It looks like that was the only one. And boy, I could talk about that continuing on down the road for forever. But thank you for that question. Appreciate that. Andy, thank you as well. Appreciate you being on here, sir. Got your message. Once again, you guys want to hear some more of these strategies for small businesses, check out Tim, Urick, and myself on Thursday. You can find that event right there on by following me, by finding me there on Facebook. Dollars and Cents Creative Spending Strategies for Small Businesses. All right, gang. Thank you so much for being with us. We'll catch you next time on Why Does Healthcare Suck? Typically 11 a.m. last Tuesday of every month. Y'all take care.